Health Minister Kweku Agyeman says his ministry will deal with the challenge of inadequate staffing, which has been blamed for the inability of public health facilities to attend to patients who need care. And ultimately, these result in deaths in some cases. Speaking at this year's Health Summit on the theme Achieving Universal Health Coverage Using Innovative Approaches, the minister said the health sector must thrive, and that must happen now. Ifwa Evans Chinri now reports.
Delay in the payment of National Health Insurance Scheme debts to hospitals has been a major issue affecting healthcare delivery in the country. At a health summit to deliberate on key issues affecting the health sector, the Minister of Health, Kweku Agyeman, dismissed claims by the Association of Private Clinics that government owes them an outstanding 15-month NHIA debt. He stressed government has settled all debts since August last year.
That cannot be correct. That cannot be correct. Have they submitted their claims? Have we vetted? And their claims are efficient? That is not correct. I've been going around the country. Last month, I think, sometime this month, I toured over how many facilities in Braham. Wherever I went, they have been paid up to August for 2017, right? So where does this 15 months come from? So if there is one isolated case, one particular person who has got that problem, let him come and complain and let us look into his challenges and see what we can do for that person.
Speaking on unavailability of ambulance services in many districts across the country, which forces critical patients to rely on motorbikes, the health minister said his ministry will re-examine the operations of National Ambulance Service and provide solutions.
The state of our National Ambulance Service is a national emergency. Recently, as part of my regional monitoring, I visited the Northern Regional Office of the National Ambulance Service. The least said about it, the better. And I expect that we might see even a few more worse ones as we continue to visit the regions. Whilst expressing the need for support to ensure efficient emergency services, there is also the need to re-examine the model of ambulance services we are running to reduce the financial burden on the Ministry of Health. The National Ambulance Service cannot thrive on budgetary allocations. It needs a dedicated funding mechanism that ensures that its operations are sustainable.
Vice President Dr. Muhammadu Bawumia assured government will continue to invest in childhood and maternal health programs in Ghana. He outlined some plans government has put in place to make the health sector one of the best in Africa.
Watson uses artificial intelligence to analyze integrated databases to improve health service delivery and enhances the productivity of health providers. This ought to be the future of health diagnostics, but at the base of it all is information, the data. And this is why this emerging system that we are putting together is so important. Mr. Chairman, maternal health indices are of major importance to any country because they are indicators of a country's level of development. This is the reason why the government will continue to invest in maternal and child health programs to minimize the risk of maternal mortality and child mortality from preventable childhood diseases. Although the preliminary results of recently conducted maternal mortality surveys show a substantial improvement in the indices, the fact still remains that unacceptable numbers of mothers and children die in our facilities. Our health facilities should be places of solace for our mothers when they are in need, and not places of imminent danger and threat to sacred life. Mothers and children should not die for lack of trying from our health workers. All of us must demand extraordinary commitment in this regard. Health policies aimed at improving access to mothers and children will be reviewed and strengthened. Exemption policies such as free maternal health delivery and free access for children.
Regional Director of the World Health Organization, Dr. Matisido Mweti, promised the WHO will continue to support Ghana's health sector.
So WHO has been very pleased to work with the government to understand and address cross-programmatic inefficiencies in the health sector in Ghana, which are common in most of our countries in the African region. I believe that if the recommendations of this work are fully implemented, they will contribute significantly to improving efficiencies. And this could also represent a best practice that other countries could learn from.
The Health Ministry has launched the Vaccination Week, which begins today and ends on Friday. Ifwa Evans Chinri for Joy News.
The Electricity Company of Ghana has installed a 20 megavolt auto transformer at the Jasikan switching station to boost power supply to customers in the northern belt of the Volta region. The General Manager of the ECG Volta region, Engineer Delali Oklu, indicated the initiative is part of plans targeted at improving power supply across the region, all in a bid to meet the continuous demand of customers. Fred Kwame has the rest of the story.
The Pando Box supply unit serves about 5 districts in the northern belt of the Volta region. Due to this, the power is vastly reduced before it gets to clients in Nkwanta and surrounding communities, hereby causing frequent power fluctuations and outages. This necessitated the move by ECG to install a transformer at the Jasikan switching station to boost power supply to customers in the northern belt. Already, voltage monitoring by ECG officials at all substations serving the north indicates the required voltage levels are being supplied to customers. Engineer Delali Oklu is the General Manager of ECG Volta.
Over the past week, we have been monitoring the voltage. We have realized that there has been a significant improvement. So we are hoping that it will continue until we have the permanent solution, which will be the KJB primary substation. And that one too, we are working hard to ensure that that one too comes on board to permanently solve the low voltage situation in the northern parts of the region.
ECG has presented a 20,000 heavy-duty printing machine to Mauli Senior High School in Ho. The donation of the 20,000 risograph, which was in response to an appeal by the Old Students Association, forms part of the company's corporate social responsibility. Risograph is a brand of digital duplicator designed mainly for high-volume photocopying and printing. It is one of the world's quality and expensive IT machines. The printer would curb the challenges Mauli School goes through in printing educational materials. Fred Kwame, Joy News.
President Akufo-Addo needs quality, not quantity. And that's according to Dr. Emmanuel Akwete, who is the Executive Director of the Institute of Democratic Governance, IDEG. Dr. Akwete, who thinks the size is unsustainable, is also uncertain about the competence of all the 998 staffers. He was speaking on JoyNews Current Affairs show, PM Express.
The president needs to be surrounded by highly competent people because he has a certain time limit to do things, and he wants the best, first class, knowledgeable, and so on. So the people who come around him or I in his offices, it's not the quantity, but the quality of people and their tested ability to deliver what he wants. You see, if we have 1,000 people and we can also prove that actually the value of the work they do generates much more than is spent on them, then it's something then we can say, okay, it's worth it. But if not, and exactly what are they doing becomes an issue. And do they really have the competencies to do the job? That will say the president's agenda is moving forward quickly, it's impacting, we are seeing results, and so on and so forth. To the extent that they are not having that kind of high level of productivity, and they are not improving, growth, and the economy is not stronger, and distribution, problems are not being solved, and so on. You want to then ask, what happened to decentralization?
An Accra High Court has ordered the Economic and Organized Crime Office to freeze the account of the former Kokobo Chief Executive, Dr. Stephen Oponi. And this follows an application filed by Dr. Oponi's lawyers, led by Samuel Kujo, demanding that the account be made accessible to the former Kokobo CEO. Iyoko last year froze Dr. Oponi's account when he started investigations into some contracts awarded variously during his tenure by Kokobo. The former Kokobo CEO is currently standing trial at an Accra High Court together with two others over various charges, including causing financial loss to the state. A copy of the court order cited by JoyNews, signed by Justice Georgina Mensandacha, indicates that Iyoko did not oppose the demand for access to Dr. Stephen Oponi's accounts. And that's it for the latest news headlines. We have more news. We'll be looking at the newspaper, do a review of the news, various newspapers on the online portals, myjoyonline.com, and subsequently the others. I'll be joined by, of course, Mama Vioso Abuaje. Stay on. We'll be right back.